Good morning, folks. Today is Thursday, April 16th, and unfortunately I have some tough news to share today. We found out yesterday that one of our teammates, a staff member from our Birch Hill community who had been feeling ill over the weekend, tested positive for the COVID-19 virus. That's hard for me to say. I'm sure it's hard for you to hear. And even though it's hard for me to say, I can't say that I'm surprised. With 1,139 cases in the state of New Hampshire as of yesterday, and with Hillsborough County, where Manchester is, and Rockingham County, where Exeter is, being the hardest hit areas, I think in my head, I knew this day would come. In my heart, I was still kind of hoping it wouldn't. But we're prepared, we're ready. I don't anticipate any major changes in our operations due to this positive test. We are already doing everything we can to keep you safe. Everyone is wearing a mask. Our health care staff wears a medical mask and goggles. Our staff that isn't in healthcare and you are wearing cloth masks. We're cleaning and disinfecting 4 times a day, proper hand washing, universal precautions, you name it, we're doing it. So this virus is creative, it's crafty, but now we switch from focusing on keeping it out of our communities to containing and minimizing any spread. The other thing that was on our docket yesterday, many of you know that we had intended to and anticipated starting testing for all of our staff members yesterday. The governor's plan to test many, almost 7,000 long-term care workers in the state threw a little bit of a wrench in that plan. The testing group, Convenient MD, had to readjust, and because they'll be doing the testing for the state. But we spent the day yesterday working with them. We'll continue with that today. And we will start testing. Our staff will be tested in Manchester and a few days over the weekend here in Exeter, Friday, Saturday, and Sunday. And all of our staff will be tested. That's a point-in-time test. It's not foolproof, but it gives us a starting point. We also believe that we will still be able to do testing for our healthcare residents in the next few weeks, and also provide the opportunity for our independent living residents to be screened, and if you qualify, to be tested also. So for now, all of our thoughts and prayers are with our teammate in Manchester, and just well wishes for a speedy recovery. Linda Fipers, who's our executive director in Manchester, I think had the best quote in her memo that will be going out to the Birch Hill residents. To remember and practice compassion for each other during this time of challenge to our community. We'll get through this, and we'll be a stronger community. We've learned that when we work together and put the larger group before our own self, we can do amazing things. And I'll tell you, that's what we've been doing for the last month and a half. We are a system. We are a family of communities. Our staff teams are working together every day to bring good ideas, to bring some fun, to help keep you safe, to help keep one another safe, and to fight against this insidious virus that is, it's something right now, but it's for right now. It's not forever. And we're learning an awful lot about one another. We're learning an awful lot about ourselves. Our team will step up. Our team is ready. We're here for you. We're here for one another. And we're here for the family of communities. And I just want to end with that. I want you to know that these are challenging times, but they're not too challenging for us. We're RiverWoods, Manchester, Exeter, Durham. We've got this. So hang in there. Wash your hands. For God's sake, stay 6 feet away from your friends. Wear your mask. And stay with us. Stay flexible, because that's what we do every day. We pivot and learn, and we adjust every day to keep you safe, to keep you healthy, and to keep bringing some fun to our days. So with that, we'll say goodbye. Love you. Hang in there.